wave.
Awesome. There we go.
Okay. It is a birth defect. It is a mental impairment. A person living with this will never live independently. These are all common misconceptions of cerebral palsy. In fact, it is not a birth defect. It is not always a mental impairment, and a person with cerebral palsy will have the opportunity to live by themselves. Today, I will be informing you on, you guessed it, cerebral palsy. You'll be learning what it is, what the types are, the symptoms, and the treatments. It is important to be informed of cerebral palsy because, except for rare cases, you can help prevent it. Cerebral palsy, also known as CP, is a group of conditions that involve the brain, which is cerebral, and the muscles, which is palsy. According to the Cerebral Palsy Facts and Statistics page in Dr. Iannelli, CP affects 3/4 of a million Americans. It is a condition, not a disease, so it is not contagious and you cannot catch it. It is not progressive, meaning it does not get worse over time, but secondary factors like muscle stiffness can get worse. 35 to 50% of people with cerebral palsy have seizures or mental retardation. It is caused by injuries or abnormalities to the brain. In most cases, brain damage occurs in the womb, but it can also occur after birth, so up to about 3 years. There's still a lot of unknowns, but evidence that we have currently shows that birth injuries, illnesses, or infections, prematurity, and lack of oxygen are all common factors. Cerebral palsy is obtained 2 ways, congenital or acquired. Congenital is present at birth, although it may not be identified for months later. It is obtained by infection, damage, or disease, for example, jaundice, STDs, premature birth, lack of oxygen, or trauma. Medical malpractice is also a big role, so choose your doctors wisely. Acquired CP is also acquired, hence the name. It occurs after birth. It's 10% of the cases. You can get it through head injury, infection like viral meningitis or viral encephalitis, drowning, or abuse. It is not genetic, but other genetic mutations can lead to cerebral palsy. Now that you know how you get cerebral palsy, you can take steps to prevent it. When you're pregnant, eat nutritious foods, don't smoke, and avoid exposure to harmful substances and see your doctor regularly. For small children, you should take measures to avoid accidents, be informed of illnesses and their symptoms, and keep your children away from people with serious illnesses. There are several forms of cerebral palsy. The first is spastic or non-spastic cerebral palsy. It is the most common form. Spastic cerebral palsy is characterized by stiff muscles that continually contract, which make your limbs stiff and causes limited motion. According to cerebralpalsy.org, 70 to 80% of those who have CP have spastic cerebral palsy. Non-spastic cerebral palsy is characterized by fluctuating muscle tones and involuntary movements. The second type is dyskinectic or ataxic cerebral palsy. Dyskinectic is when your muscles go back and forth between being tight and loose. It also has involuntary movements that can be rapid or jerky or uncontrolled and slow. These movements occur mostly in the neck, face, hands, arms, legs, and occasionally the torso. Ataxic is the rarest form and affects the whole entire body. Those who have it have problems with balance, precise movements, hand control, and coordination. The last kind is a mixture of the forms. Classification is based on how many and which limbs are affected. So with dysplasia, only the legs are affected. With hemiplegia, one arm and one leg on one side of the body is affected. With paraplegia, the lower part of the body, including the legs, are affected. In quadriplegia, all the limbs are affected. And with pentaplasia, all limbs, including the neck and the face, have paralysis and is also accompanied by eating and breathing complications. The symptoms, thanks to March of Dimes website, include, or you should keep an eye out for, at 3 months, if the baby does not turn to a sudden noise or familiar face, and doesn't have facial expressions like smiling. At 5 months, if the baby does not hold its head or lift its head when picked up from a lying position to a sitting one. At 6 months, if the baby does not roll over or pushes food out of its mouth instead of accepting it. At 8 months, it cannot sit with support. At 12 months, it cannot crawl, or it crawls with only using one side of the body. And 8 months, it prefers only using one hand. You should call the doctor whenever you see anything I mentioned before, or stiff muscles, unusual posture, or if the infant is feeding and sucking poorly or floppy. It is diagnosed based on observations of physical development, a physical exam, medical history, and other tests like MRI, which shows brain abnormalities. There isn't a cure. However, treatment can greatly improve their condition. Routine checkups all the way into adulthood to adjust, add, or take away treatments as changes occur. Possible treatments are physical therapy, which helps improve strength, flexibility, and balance, and they'll probably have that throughout the rest of their life. Occupational therapy, which helps with fine motor and self-help skills, and that'll improve their chances of living on their own or having a job. Orthotic devices improve balance and mobility as well. Those are braces, casts, splints, and wheelchairs. Behavioral therapy helps the child communicate better and learns how to communicate with others, and especially their peers. And medication helps prevent pain, seizures, and helps muscles relax. Surgery helps improve severe cases of deformity and spasticity. So whether you're a dad or a mom, an uncle and aunt, a grandpa or grandma, a sibling or a babysitter, you're most likely at some point in your life around a child who is vulnerable to cerebral palsy. Unlike a couple of minutes ago, now you know how to prevent cerebral palsy, what it is, and what symptoms to look for. So protect those special little noggins, because any damage to them can be life-changing. Thank you.